Okay, well, thank you for that. Quite a lot of people might not actually know what this particular talk is about. It's got a rather vague title, the NAP6 tools, and I'm not going to be presenting you with any specific data from NAP6 in this talk. It is about some resources and forms that have been made available, perhaps to combat some of the difficulties we've already seen that have been highlighted by some of the previous talks already given. So these are downloadable guidance and forms to assist in the management, referral and advice for clinicians and also for administering and giving to patients, sending to GPs. They are included in the report, and I'm going to tell you which chapters they're in a moment, and they're listed as appendices. They'll also be accessible from the main NAP6 report page. So in Chapter 11, which is the immediate management chapter that Nigel's just been talking about, there are essentially 4 appendices, one of which has a number of different parts. So the first one is anaphylaxis treatment packs, which I'll start with just now. The treatment packs should be located in all areas where anesthesia is administered. This document isn't actually a pack that includes what you need, but is specifying what might be of benefit to have in these packs, including the drugs, treatment algorithms, and information on where to find the investigation packs. The following pack is the investigation pack, which has a number of additional component parts to it. It should be accessible and available in all theatre areas, and the suggested contents include information about local mast cell tryptase sampling, timing sample bottles, including sample bottles if possible, instructions on how to refer to an allergy clinic with details of where that allergy clinic is for the local area, and including a NAP6-based referral form. Documentation, both for the patient and the GP, to be given prior to discharge as immediate information. So these are pre-formed letters that are available. There's also advice on reporting to try and encourage reporting. So these 2 first packs would help to counteract some of the issues that we've had with communication, but also with access to drugs. As Nigel mentioned, glucagon may not be instantly available. And one of the stipulations in the treatment pack is that that should be readily available within 10 minutes of an area where anesthesia is provided. Another resource that's been created through NAP6 is we've called it the urgent advice, and this is really for patients who cannot wait for their expected surgery. They cannot wait for an allergy assessment. So this is structured advice that's come out, and I'm not going to go through all of the recommendations in there, or we would run out of time again, but basically it provides a tool for anaesthetists if they are unable to get allergy assessment undertaken in the time that's required for urgent surgery. So it includes certain things like evaluate which drugs were given during the suspected event. If a neuromuscular blocking agent was used, then avoid all neuromuscular blocking agents. The number 1 point on this is it's important to speak to an allergy or clinical immunology service, if at all possible, before progressing, and discuss that case to try and get some tailored advice. But if that's not possible, it does give advice that can be followed by anyone, really, on what might need to be avoided, and alternative routes to achieve the same degree of anesthesia, whether that be local or otherwise. So there's lots of structured advice in there. The next bit, which probably needs a little bit of time and focus, is we've already realized that reporting is a bit of an issue, keeping data together may be a bit of an issue, education may be a bit of an issue. People might not know where to refer, how to refer, what to do. As we've said, these cases are very rare for the average anaesthetist, and therefore the recommendation is that there should be an anaphylaxis lead. And the roles and responsibilities, we've had an attempt at defining what those might be. And they include particular focus on education and training, a link between local anaesthetists and allergy services, ensuring that the recommendations and guidelines are followed. And it comes into that other point as well of trying to make sure that further referrals have taken place, not only been made, but they've been taken forward to completion, that these patients have been referred and have a follow-up and further arrangements made. One of the final points that's significant in this is it asks for coordination of follow-up to look for adverse sequelae from the event. So this is quite a broad role, But given the lack of frequency with which these cases arise, it's felt important to try and define it. So there are two other tools or resources that are linked through the NAP6 report, and these ones fall within Chapter 14 on investigations. Now, you haven't had the talk yet on investigations, so I hope there's not too much overlap with Bill's talk a bit later on. Basically, this is all about communication and GEN, basically. So there's advice on what information should be included in clinic letters coming from the allergy clinic. And I think this is very important because you can see a wide variation in the information that actually comes back from the allergy clinic. It could be as brief as anaphylaxis to X has been confirmed, avoid X. It could be very detailed. So we felt it might be useful to provide allergy clinics with a pro forma type template of the information that would be useful and could be then independently interpreted by anyone in the future. This is also in line with NICE guidance and provides sufficient detail to ensure future safe anaesthesia. There's again details on reporting, and again I don't want to steal thunder from others on MHRA reporting, but a lot of these documents include detail on internal and MHRA reporting. So the final tool is essentially a letter that should go immediately with the patient from the allergy clinic. So the patient leaves with structured advice on the testing that's been done, what's been identified, what needs to be avoided, and it provides very clear and instant advice for the patient, carers, family, and also that can be copied off to GPs. So I've gone well under the time required, so hopefully we'll be back completely on track with timing, and I'll hand over. Thank you.
I have to say that Tomas's little slide up the front here is green and all for go. Well done. That was an excellent run through the outcomes that NAP6 is developing. Next up, we have Tim, who's going to tell us about the deaths and cardiac arrests that were reported to NAP6. Thank you, Tim.